The topics and opinions expressed on the following show are solely those of the hosts and their guests and not those of W4WN Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4WN Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4WN Radio.
Hello and welcome to Fearless Fabulous You. I'm your host, Melanie Young, and I love helping women live life on their terms and take charge of their health and put their self-care first. So today we're going to do a very important show on a topic that's actually affecting me personally. And I think it affects, would you believe, between 24 to 32% of women. That's right. We are going to open your eyes by opening your legs and talk about pelvic floor disorder and the fact that this is a very serious problem for many women of all ages. I am experiencing it right now. I just had breast reconstruction and I have prolapsed uterus. My mother had a prolapsed uterus. I always thought it was from being overweight and old, but there are other reasons. But the symptoms of a pelvic floor disorder can increase with age, childbirth, postpartum recovery. I never had children, but as I dove into this topic, on the website of my expert guest today, I was like, wow, this affects a lot of women. And, you know, if you sneeze when you pee, if you have trouble holding it to get to the bathroom, if you have any kind of incontinence or you feel like your inside plumbing is about to come out, the show is for you, and we're going to be open and frank. And this is a great topic, a good space, and a safe place to talk about it with my expert. We're talking with Dr. Sara Reardon. She is a pelvic floor therapist here in New Orleans, Louisiana, but a clientele around the world probably, because she is the founder of the Vagina Whisperer. That's www.vagwhisperer. And it is really a great site to learn about caring for your pelvic floor. I actually heard her speak. She's a TEDx speaker. I heard Dr. Reardon speak at the New Orleans Book Festival at a standing room only seminar on women's health, which shows how important this topic is. She is author of the book Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Every Stage. It's a very good book. I'm reading it online now, and because it's affecting me right now, I'm learning a lot. So Dr. Sara Reardon, welcome to Fearless Fabulous You.
Thank you for having me, Melanie.
Well, you are fabulous for so many reasons. You're the only person I know that actually has a vagina uniform you wear around you.
It's a vulva costume, and surprisingly, I have many of them. So, but in New Orleans, we all have costume closets. So this is what's in mine.
You are so cute. I loved Floored. I thought it was a terrific book. We're going to talk about a topic that nobody wants to talk about, as you well know, and it should get out in the open. And you're driving the conversation because too many women are suffering in silence.
Yeah.
But let's get to the meat of the matter and go down there. What is the pelvic floor? Because I had to learn what it was myself.
Yeah. So the pelvic floor is a group of muscles that sit at the base of your pelvis. So we're all used to seeing that bony skeleton, at the base of the spine that we maybe see at the doctor's office or even on little skeleton pajamas that kids wear. And at the bottom of that ring of bones is a basket of muscles called your pelvic floor. So literally the floor of your pelvis. These muscles support your pelvic organs. So your bladder, your uterus, your ovaries, your rectum all rest inside of that basket of muscles. And these muscles also have 3 openings in the female body, one for urine to exit the body, the anal sphincter for stool to empty the body, and then the vaginal opening for vaginal intercourse, menstruation, and vaginal birth. So these muscles are working for us all throughout the day. As you mentioned, every time you sneeze, when you have a full bladder and you're walking to the bathroom, when you're lifting something heavy, but even just simple things like getting out of a chair or lifting our grandkids or children, or exercising, lifting weights. And so, and then again, going to the bathroom for pees and poops. So these muscles are really important, yet we don't talk about them often. And we don't even know they exist sometimes until we start experiencing a problem. So my mission is to really help women better understand their bodies, to have proactive tips to take care of their pelvic floor. And then also, if they are experiencing issues, which as you mentioned, many women will, what can they do about it instead of suffering silently?
Exactly. Too many people are not driving the conversation, and they're afraid that, they're afraid to talk to the doctor. Insurance won't cover it. I was actually like appalled at all of this because it's such an important thing. My mother had a prolapse uterus for many years and ignored the doctor and suffered in silence until finally it was like coming out of her. It was the rose. She had to have a surgery. It was a hysterectomy, whatever, the whole thing. And then when I found I had a prolapse uterus, the first thing that happens is you kind of go, what did I do wrong? So we need to
Right.
talk about it's not your fault, but what can you do to
Absolutely.
protect yourself? So let's talk about that.
I think the things so prolapse is when this hammock of muscles is not supporting those organs as well. So your uterus can kind of start to push down from the top of the vagina. So the cervix and the uterus are at like the very top of the vagina, the vaginal canal. Think of
Mhm,
it like the top of a tent, like the pitch of a tent. And when
mhm.
that starts to drop down, you'll feel pressure or heaviness in your vagina. You may feel the cervix at the opening. You may feel like something's getting hit or pressed on during sexual intimacy. But then you may also feel like your bladder's not emptying well, or your bowel movements aren't emptying well, or you just have this pressure or heaviness or bulge in the vaginal opening. All of those are signs and symptoms of prolapse. This is very common, but some of the things that can contribute to it are multiple vaginal births. So having 3 or more vaginal births, straining. This could be straining with lifting weights, straining with bowel movements, being on your feet a lot. There is a very strong genetic component. You are at a higher risk if you have a parent or an aunt or kind of a first line relative who's had prolapse. And then there are just kind of different things with aging. When we are in menopause or postmenopause, our connective tissue in our body changes. We see that in our skin, in our hair, right? It also happens in your pelvic floor, where those connective tissues of the pelvic floor muscles just aren't as supportive, and your organs can droop down. So there are many reasons this can happen. I think we often think, what did I do wrong? Or like, is my body broken? Those things are like, you did nothing wrong and your body is not broken. But these are things that we should be educated about because they can happen. And instead of suffering like your mom, there's help that can be done sooner.
Exactly. And you were a pelvic floor therapist, said that well, which is a specialty,
Yeah.
and you need to seek one out. So when I had my recent breast reconstruction and there was a whole rearrangement of my insides, they said you need to get pelvic floor therapy. I already had the problem, but then I had the surgery. I was so I have many questions. How does weight fluctuation impact this? We have a lot of women who
Yeah.
are taking GLP. And I do want to underscore men do have this problem
Pelvic floor
too, but
issues. Absolutely.
yeah, we need to
Yeah.
underscore that. But women have like the physique that tends to be more impacted. So how
Right.
is that happening? Are you seeing women coming in because they've dropped too much weight, or how's that
Is
happening?
It can go both ways. So everyone has a pelvic floor, all genders, and
Hmm.
men or trans folks can also have pelvic floor issues as well. I focus mainly on females. Again, I'm the vagina whisperer, but because we go through life transitions like pregnancy, birth, periods and menstruation, perimenopause and postmenopause, where our pelvic floor is directly affected, and
Hmm.
having a vagina makes you more vulnerable to pelvic floor issues. So when the way that weight is involved is there is research to show that a higher amount of abdominal weight can cause more pelvic floor weakness. If we think about these muscles like a hammock that have to support something, a hammock holding up a 5 pound weight is very different than a hammock holding up a 10 pound weight. And so
Right.
the more pressure or weight above can increase the likelihood of pelvic floor weakness, incontinence, or prolapse. But if you are taking a GLP-1, there's a couple things that can happen. One, that you have dramatic weight loss, which can be helpful to your pelvic floor because you have less weight, but you also tend to lose skeletal muscle mass. So your pelvic floor muscles are a skeletal muscle, which is like just like your bicep, a muscle that you can contract and relax and strengthen. When you lose skeletal mass or muscle mass throughout your whole body because of rapid weight loss, you also lose it in your pelvic floor. So it could happen either way, that you also have some pelvic floor weakness, And we also call it, like, there's something called ozembic vulva, where the tissues start to get lax, a little bit saggier. You may notice that your labia are a little bit droopier or less plump. It's because if you have less fat in the area, so that can cause that tissue to sag a bit more. On the other side, again, we said weight loss can also help pelvic floor issues. But the one side effect to be aware of if you're taking GLP-1s is that it can cause constipation. And the reason for this is because it slows gastric emptying, right? Like, everything is kind of slow and sluggish in your colon. It keeps you full longer. But when you have harder stools that are difficult to empty and you end up straining to poop, that weakens your pelvic floor. So a lot of my patients and women that I work with, I tell them, like, make sure you're taking a stool softener or magnesium gummies or citrate to help soften your stool, stay hydrated, 30 minutes of physical activity a day, and getting a fiber-rich diet, because straining with bowel movements will weaken your pelvic floor more than running, jumping, coughing, all the things we think weaken our pelvic floor. So manage your bowel movements, and then make sure that you are doing pelvic floor strengthening exercises, even if you are losing weight.
Well, two things. I think a lot of women strain, because I think about the pain. Mine was like a tummy tuck, but it looks like a C-section. And I was you're so constipated because of the drugs and the painkillers, and women I don't know. I got to tell you, Dr. Reardon, Sara, I have so many friends who complain about constipation, and that straining is so bad for you. And I think that's a big issue that people don't know what to do about it. And it affects how they eat and do anything.
100. It affects how you feel. I mean, you never feel better than when you take a good old poop in the morning, right? The rest of your day is set up for success. But I think one of the things is it is the most common gastrointestinal complaint in the United States right now. We're not moving enough, we're not hydrating enough, and we're not eating enough fiber. So you have to do those things. The other thing I'll say is that when you're constipated, you have a lot of stool in this pelvic cavity, a lot of poop in the area, and that actually can put more pressure on your bladder and cause you to have to leak even more. So you may find, if I'm constipated, I actually have more urine leakage. So, I'll have somebody come in and they're like, I'm here for my leakage. I'm like, well, let's talk about your pooping, because that influences your bladder health as well.
Well, I want to talk about exercises, because one of the things, and then we'll talk about going in to actually have an exam, because that was interesting. I read on your blog, I downloaded the book about exercises for pelvic health, and it's free. Everybody should do it. Vagwhisper.com. And it says you don't just do Kegels. Okay. I was taught and put in my book on getting through breast cancer recovery, Kegels are important, and then you're always doing them. I'm on the plane doing them. I fly a lot, so constipation is a big issue. I'm always doing them when I just think about it. But you're saying that's not enough. Talk to me about that.
Correct. So I think first thing is, not everyone does need pelvic floor strengthening, or what we call Kegel exercises. So Kegels are pelvic floor contractions. Think of it like your bicep muscle, you bend your elbow and you contract your bicep. The same thing goes for your pelvic floor. If you kind of contract your pelvic floor like you're holding in gas or urine, that's a pelvic floor contraction, and then you relax it all the way. Now, some people have tension. So if you have painful sex, if you have, like, you strain to pee or poop, you might have tension, and Kegels could be the wrong thing for you. So the first thing is kind of determining which pathway you need. And in my book, Floored, I go over that. In my app, the VHive, you can check that out for free for a week. And it walks you through a quiz of, like, which pathway do you need to go down. But then if you are on this strengthening pathway, it's not just Kegels, because the reality of it, Melanie, is you might do Kegels when you're sitting at a stoplight or on the plane, but that's not when you leak urine. Right? You leak urine when you're walking to the bathroom with a full bladder. You leak urine when you're jumping or lifting weights at the gym. You leak urine during a cough or a sneeze. So you need to use the muscles and train the muscles during the activities that you need them to work for you. It's often not in sitting where we have all these problems, but that's when we kind of find a way to work our muscles in, or our Kegels in. So a lot of this is getting the contraction down, doing quick contractions and longer hold contractions, holding for 5 or 10 seconds and then relaxing, and then building that into weightlifting and exercise and movement, so those muscles are working for you all throughout the day.
And also breathing at the right time when you're doing them is important as well, because it kind of goes hand in hand.
Not holding your breath.
So I learned, no, go ahead. Not holding your breath is key, and breathing when to exhale and inhale.
Yeah, it's tricky because I think sometimes we're just not taught how important that breath piece is. But I actually coach a lot of my patients. I say,
Hmm.
okay, hold your breath and then try to contract your pelvic floor. It's really hard to do. So I tell folks to kind of just take an
Hmm.
inhale to relax. And on the exhale, then you lift the pelvic floor up. I always say a Kegel is like you're sucking up a smoothie with your vagina. It's like a suck up. It's not a squeeze. So it's a pulling up and
Hmm.
in on the exhale, and then you relax completely. So I train folks just to finesse that contraction and then build it into things like squats and lunges and upper body strengthening. So the breathing is important. Ultimately, I just say don't hold your breath. We don't want you holding your breath when you're exerting effort because then you're not going to get the most out of this exercise.
A lot of the exercises are also the same exercises that my back physical therapist gave me to deal with
Yeah.
my lower back. And doing my research, I learned the interconnectivity of your pelvic floor with other parts of your body is fairly significant. So let's talk about the back.
Yeah. So your pelvic floor is part of your core. We always think about your
Mhm.
abs, like that's your core, but your core is a
Right.
canister. Your abs are in the front, your low back muscles and upper back muscles are in the back. Your pelvic floor is at the bottom, and then your diaphragm or your breathing muscles at the top. So think of it like a can of Coke, like that whole canister is your core. So when you're doing back exercises, you're working your abs as well. When you're working your abs, you also want to be thinking about working your pelvic floor. So all of these muscles work together. A lot of the exercises you'll see in my app, the VHive, are core exercises that we think of as like planks and push-ups and squats and lunges and weightlifting, but it's because it's working your pelvic floor as well. It's not just an ab exercise or a low back exercise.
Yeah, the bridge is my favorite. Are there exercises that you would not recommend that could
Yeah.
actually hurt your pelvic floor?
So I always tell folks to work kind of underneath their symptom threshold. So what that means is that if you can jump rope and you maybe can jump rope 10 times and you're fine, but on the 11th jump you leak urine, then you stop before then. Or if you have, tailbone pain and you're doing some squats and you can squat for 3 sets of 10, but you do more than that, your tailbone starts to hurt. So always kind of follow your symptoms. Like, if you leak or have pain or pressure, those are signs that you've gone too far and you stop before them. I also encourage you to kind of not push out or bear down, like lifting too much weight where it forces you
Mhm.
to hold your breath or to push your abs out or to push down on your pelvic floor. That's just too much load for what your body can handle if you're having to compensate in all of these other ways. But most things are everything is possible. You can run, you can lift, you should lift weights, you can do yoga. Like all of these things it's not about what you're doing, it's much more about how you're doing it and integrating that pelvic floor contraction and relaxation into those workouts.
I think you said important with how you're doing it. Too many of us just
Yeah.
jump on and so and you go to these core studios, core exercise studios, and you really everybody is different. It's not cookie cutter, the core situation.
Yeah.
And you got to be careful because you can actually injure yourself by not doing the exercises properly.
Yeah, and then even in your case, Melly, like after, we see a lot of patients after a hysterectomy or a tummy tuck or a C-section, like
Hmm.
though there's a special like core engagement program that you want to be doing post-surgically.
Yeah.
Like you shouldn't be going back to like what you were doing before. It's like a rebuilding or rehabilitation process, just like you would if you had a knee surgery or a shoulder surgery, right? You
Right.
get PT after those. It should be the same thing when we have abdominal surgery. So it's a slow rebuild of the core and then getting back into kind of more intense or heavier weightlifting.
Yeah, you're not bouncing back. I mean, I was given permission to go do a Pilates, but I'm still doing through my insurance because I need insurance. I'm on Medicare, which I want to get to because not always covered, which is weird to me because to me it's a medical condition. So why isn't it
Right,
covered? But why is that?
right.
I mean, testosterone treatment seems to be covered for men, but what
I
about
know.
this?
It's really wild. So, what you're alluding to is that pelvic floor physical therapy is often out of network with insurances, which means it's cash pay. It's like you pay a flat fee. But there
Hmm.
are, if you have insurance, pelvic floor physical therapy falls under regular physical therapy. Like you can go and get 12 sessions approved for something. The tricky part is that insurance doesn't reimburse very well for physical therapy. They kind of have designed it like when you see a PT for your back, they've got 2 to 3 patients in the gym at the same time and they're kind of bouncing around.
Mhm.
Pelvic floor physical therapy is one-on-one. It's in a private treatment
Yeah.
room, usually for 45 minutes to an hour. So insurances don't pay enough for us to be able to offer that one-on-one care. And it's really hard to do that in an insurance-based platform. So, a lot of insurances or a lot of clinics are out of network. So you pay a flat fee. The good thing about that is you can file it for out of network coverage. So it goes towards your out of network deductible. And oftentimes you don't have to, it's not PT where you have to go 3 times a week. You go once a
Right.
week, once every other week, and then we give you a lot of things to work on at home. So it's different. It's not ideal. Unfortunately, because they're squeezing providers for so much. We're not
crazy.
able to offer the kind of care sometimes that we want to, especially when you're a smaller practice or clinic.
I couldn't agree more. I mean, I had to get cancer to get half my treatment. So boom.
Oh my goodness.
I'm under cancer rehabilitation. Wow. What an honor. Come on. This is a problem. We won't get into but that is a problem.
Yeah.
But you brought up something really important. So when I had back therapy, yes, I went to a wonderful physical therapist. There was different people in the room. It's like being in the gym. It was great. But this is not the case. There's no way you can do pelvic floor therapy with other people. So I think this is important because I didn't, other than looking at your website, I went into my, Toro hospital place, and it was kind of interesting that first session. Talk about what it's like to meet with you and what the sessions are like from the beginning.
Yeah, I think with anything new, it can feel overwhelming. It can feel a little bit scary and mystical, like what's going on back there. But, it's one-on-one with a therapist. So you go into a private treatment room with a closed door. You're not in the middle of a big gym, like you mentioned. And then actually we just sit and talk for a little while. We spend about 15 minutes and I'll ask you questions. Like you might be there for a breast cancer treatment, but I want to hear about your bladder health, your bowel health, your sexual health, if you've had any previous births, your periods, post-menopause, all of your exercise, your pooping habits, all of these things to kind of get a good, clear picture of your pelvic health. And then I'll do an external kind of muscle assessment, which means I look at your low back, your hips, all of that you're clothed for. And then for the internal portion of the exam, I'll step out and then we have you cover up with a gown or a sheet from your waist down and you lie on a comfortable mat. And then we do the internal portion, which means I'll, pull the sheet back. It's similar to a gynecology exam, but there's no stirrups or anything like that. You're just lying on a mat. And then I'll ask you, okay, Melanie, I want you to do what you would think of as a Kegel or pelvic floor contraction. And then you relax. And I'm just watching because you can see the muscles contract and relax, then push out or bear down like you're having a bowel movement. I'll see what the muscles do. And then I'll press gently on the outside of the vulva. And then I'll insert a glove lubricated finger and do the internal vaginal exam, which includes, that's me assessing the pelvic floor muscles. That's how we assess them, is through the vagina or through the anal opening. And then I'll ask you the same thing, squeeze, relax, push out. I'll press on the muscles, see if there's tenderness or, check your strength for weakness. And then that gives me a good idea, like, is this a pelvic floor muscle problem? Because some people come in and it's not their pelvic floor. Do they need strengthening? Do they need relaxation? A combination of both. And then we're able to create a plan. And we definitely give you things to work on at home. This is why I think it's helpful to have resources like exercise videos at home or an app or, the book, or because we only see you once a week. And I tell patients it's the other 6 days and 23 hours of the week that matter, not even just the 1 hour you see me. But I think more than anything, people find it really helpful to understand this part of their body. And I'm like, they're like, I'm having pain with sex because my muscles, my pelvic floor is tight, or, I'm leaking urine because my muscles are weak, just like you get weak biceps or weak hamstrings. So it's, we ultimately want you to feel comfortable. You don't have to have the internal assessment, but it is a way for us to access these muscles and test them.
I think, I wonder when and I didn't do a lot of reading up. So I was like, okay, but I'm so used to being touched because I've been opened up all over the place. So I'm like, okay, cool. But for anyone who the internal assessment is important, and just step out of your inhibitions. It's perfectly normal. It's part of the process. Any doctor, any gynecologist, You've got to do, it's part of the process. So don't like skeeve out or get weird. It's part of the process. I actually had a
Yeah.
great chat with my husband afterward about it. I go, well, I had an interesting day today. But it is so important because you've got to have a full assessment of what's
Right.
going on down there. Unfortunately, I don't have the leakage problem. Well, okay, what's what it is? Why is it when you have to go to the bathroom, the closer you get to your house, and then you can't open
Yes.
the door? You
Yeah.
can't get in happened all the time in New York City because there are no bathrooms in New York City. And by the time I'd be there, my husband would be like, I can't find the key. Where is it? I'm like, get the door open, damn it. Why is that?
I know. It's scary. So this is a type of a symptom called urinary urgency. So when the urge comes on really, really strong to pee and you feel like you're not going to make it to the bathroom in time. And if you end up leaking urine during that time, it's called urge incontinence. So this is different than stress incontinence. Stress incontinence is leakage with like a cough, sneeze, run, jump, when there's pressure on your bladder and pelvic floor. Urge incontinence happens when you have the urge to go. And this is like key in the door syndrome, when you're opening up your front door and can't get there in time, or if you're washing your hands, or anytime you hear running water, the shower's on, you feel like you've got a strong urge and might pee. So the trick to this is a couple things. Is one, you likely don't have a super full bladder. What I tell people to do is like pause, take a couple big deep breaths to kind of quiet your nervous system, contract your pelvic floor, do some 5 or 6 Kegels, and that tells your bladder to chill out, and then walk calmly to the bathroom and then go and empty. But if you start rushing, your nervous system gets upregulated and then actually tells your bladder like, I gotta go, versus you like pause and you're like, bladder, I control you, you don't control me. Squeeze your pelvic floor to suppress the urge and then walk to the bathroom, feeling more in control. And it takes practice. It's not automatic, but it's the more you practice it, the better it can get.
So versus the scissor walk, and importantly, just go. I make a point. I never pass a bathroom without going, at least trying to go without straining. But if I'm at a restaurant, if I'm at a meeting, wherever I am, I go before I leave.
Yeah, and so that's well, the trickiest thing is that, Melanie, that's called just in case peeing. And a lot of folks are guilty of that. But what happens is that if you go too frequently, your bladder can shrink, and that makes you feel like you have to go pee all the time. Yeah. So what's normal to pee is every 2 to 4 hours during the day. So like if you're leaving your studio or leaving your house, and you're like, oh, I think I have to go pee, go ahead and go. But if you get to your house and you don't really have the urge, but you're like, oh, let me just go ahead and go before I start cooking, like those just in case pees are the ones you want to cut out, because then your bladder thinks it only has a little urine in it and then wants to empty, and then it will get in that habit. So your goal is to about at least every 2 hours to make it to the bathroom. But if you have like wine or coffee or caffeinated tea or a fizzy drink, that will cause more urgency as well.
Yeah. Did I read somewhere you didn't love fizzy drinks, or is that somebody else?
I love a fizzy drink.
Okay, so you're the fizzy
They're
drink.
not good for your.
So
They're like, if you have urgency to pee, your bladder doesn't love them. But I personally like them, especially in this hot New Orleans weather. So
I couldn't agree more, particularly Lambrusco. I'm big on that. But I did read that when I was reading your book. So I want to get into postpartum, but first I learned that pooping is a big thing. You recommend having a poop stool. There's a poop position you should be in. Now it's interesting because I was in Italy recently at a very remote restaurant where the toilet was a hole in the ground.
Yeah,
and I had to do the squat to pee.
Yeah,
and it's hard, but that's apparently it's a better position. Let's talk about proper pooping.
Yeah. So the best position to relax your pelvic floor muscles, which hold in pee and poop, the best position to relax those muscles is squatting. So if you think about, if you have ever seen a picture of a woman giving birth, her legs are kind of hiked up to her ears. It's like a squatting position. If you are in the woods or in, a remote restaurant in Italy, you squat over the ground to use the bathroom, because it's the best position to relax your muscles down there. In the US, we have toilets, and that's an artifact of when they used to have outhouses, and they had modern plumbing, and then they brought everything inside. Instead of a hole in the ground, they put a chair over it. So that's how we got to modern day toilets, but it's actually not the best way to empty your tanks. So I tell people for pooping to get a step stool, or what we call like a little pooping stool, and you can get them on Amazon. or any store, Target, Walmart, wherever, and then you put it underneath your feet while you're pooping, and that puts you in more of a squatting position to relax your pelvic floor. So it's a great way to minimize straining with bowel movements. For peeing, you don't have to have one, but if you do feel like you have a hard time starting your stream or emptying completely, I do tell people, try using that stool under your feet and see if it helps you empty your bladder without having to push.
Well, I thought that was interesting. And you do sell, you do have an online shop at vagwhisper.com with some of these items.
And that's like an Amazon link. I just get, those are the questions I get asked the most frequently, like, what's that stool for pooping? So, I just link the things that are like every bathroom in my house has one. My kid's bathroom has one. It's really something that just should be automatic for us. But again, we're never taught these things often until we start having a problem.
Well, most of the time we don't want to discuss it. So it's interesting. So this can pelvic floor problems can increase with age, nearly 50% in women 80 plus. Ugh. And that's why so many elderly women pee everywhere. It's sad.
They do.
I mean,
it is sad.
It's really sad.
Well, it's sad, but I think it's also unfair. I think it's like we pay a tax for having a vagina, and I don't think that that's fair. So we're more vulnerable to pelvic floor changes because of our anatomy. When we hit menopause, we have like no estrogen left in our bodies, and your vulva and vagina and pelvic floor need estrogen to stay thick and plump and strong and lubricated. So you'll notice as you get older that you may have more vaginal dryness, more urinary urgency, more bladder leaks, more discomfort with intimacy. And all of that is due to low estrogen in the area. So using a local topical estrogen cream, if you are not, if you don't have any kind of medical history that would inhibit you from doing that, can be really helpful to plump up those local vaginal and pelvic floor tissues to help with leakage and lubrication. But you also have to do your pelvic floor strengthening. 50% of women over the age of 65 leak urine, and it's one of the number one reasons for admission to a nursing home later in life. So we're not even just talking about that this is inconvenient or embarrassing. It literally affects our quality of life and our longevity because of these symptoms. And I think that women deserve to have this training earlier in life to prevent these things from happening, because we know that these changes are going to take place, just like we do screenings for heart health or bone health or diabetes. We need to be doing pelvic floor screening and training as well.
Is there a certain age that you would recommend people start screening for their pelvic health? And then we'll talk about pregnancy, which kind of makes everything go topsy-turvy.
Yeah. I think the most important thing is to know you're normal. Like, how often is normal to pee? Yeah. Sex should not be painful. How often is normal to poop, which is 3 times a day to 3 times a week without straining.
3 times a day? Wow.
3 times a day to 3 times a week is considered normal. So I think that for most people, just kind of knowing if they're not in that normal range, that warrants pelvic floor training. Now, I think after having a baby, you should absolutely see pelvic floor therapist. If you're in perimenopause, absolutely see a pelvic floor therapist. Like, I'm 43 and I already know my pelvic floor muscles are changing. And I'm so grateful I have this information, but everyone should have this. And then postmenopause, you should as well. And again, or after any change, like a surgery, hysterectomy, hernia repair, tummy tuck, breast cancer. If you have kind of these life-altering events, those are also reasons to get your or a hip surgery, hip replacement. Those are all reasons to get your pelvic floor checked as well.
I have so many friends going through hip replacement. So, I got to tell you, Sara, not one of my surgeries, and I went through mastectomy, salpingo oophorectomy. Finally, we get to the 3rd breast reconstruction. And by then, I had a stomach plication because my whole core is just, it was gone, my back. And I had a very complex surgery. Stomach plication is seriously complex and painful, but
very
tight taught. But they said, you need to see a pelvic floor therapist. But I'm like, what? It took all this time. And I've been having issues all this. Yeah. I mean, come on. I'm 67 now. What happened in the 50s?
Well, and if you think about this, if you have a shoulder injury, you have a rotator cuff problem, you get physical therapy before, you get your shoulder surgery, you get physical therapy afterwards for months. You have a prolapse repair and they send you home. and that's it.
Yeah.
And so we're not looking at these female gynecological procedures as warranting therapy, but it absolutely should be part of the standard of care prior to therapy and prior to surgery and post-surgically, just like we do every other orthopedic injury. These are muscles that need to be rehabbed and trained. And I think it just hasn't been integrated into the medical system. And that's what we're really trying to change.
Oh, we got a lot of work ahead too. I mean,
We
it seems
do,
like,
but we're doing it. We're talking about it and we're doing it.
absolutely. I mean, men, they can't get it up and they can't whatever, and they suddenly, boom, there's something for them, easy peasy. And you said, and this show is for women, but men do have frequent pee issues as well.
They
Is that
do.
tied to their pelvic floor or their
It can
prostate?
be both. We see men who have urinary leakage, erectile dysfunction. Both of those things are common after a prostate procedure or surgery. But we also see
Yes.
men who have pelvic pain, testicular pain, scrotal pain, pain with bowel movements, premature ejaculation, sexual dysfunction. So there's, all of the things that can affect women outside of menstruation and birth, men can also experience. Unfortunately, I feel like women are really great about talking to one another, like telling our friends and our girlfriends
Right.
and getting resources. I think men often don't speak up soon enough because they don't know what's going on and their symptoms can progress significantly until they find their way to therapy. But again, seeing a urologist for a male or a urogynecologist for a female is essential to getting a diagnosis as well.
Well, that was my next question. Who do you see? As I was at the Walgreens in line for a prescription, I saw a woman buying a giant bag of Men Depends, and I was like, "Oh, I have a show coming up. You should be on it." Because if everyone out there, if you do have a spouse or a partner or a father, my father didn't want to talk about it. Get them to talk about it, or encourage them to go to a urologist if they are experiencing symptoms. They shouldn't suffer in silence either, because when they suffer in silence, it seems like it's not silent, it gets worse. They're not good at suffering like we are.
I tell you, it's unfortunate because I think that as women, we like white knuckle our way through a lot of medical experiences. And I mean, the research is also very clear. Women are more likely to be gaslit, ignored, dismissed in medical appointments than men. So we're kind of like, we get blown off a lot, drink wine and use lube if you have pain with sex, or just give it 6 months and use some panty liners if you have incontinence. So, I think that one of the hardest things, but one of the most important, is we have to be our own advocates. Like you have to push to get the therapy referral. You have to push to get the doctor to take you seriously, because the research and the education for them has not been available. And we need to get the support that we deserve, but we do have to push forward and advocate for ourselves.
So what about vaginal rejuvenation? I've heard that term. What's that all about? Is this good for pelvic floor? Or is it just another way to,
So there's a couple different types of vaginal rejuvenation. So your vagina is part of your pelvic floor. So the vaginal canal is kind of surrounded by the pelvic floor muscles. The two types of vaginal rejuvenation are external. So the vulva is everything outside, like the labia, the clitoris, the vaginal opening, the anal opening, and the urethral opening. So vaginal rejuvenation externally may be like trimming the labia. So kind of having a cosmetic surgery to shape the labia that you'd like it to be, right? So that's kind of an external vaginal rejuvenation. Internally, you can have a surgery to tighten the vagina. That could be a surgery to kind of make the opening smaller. It could be also a laser treatment where they have laser therapies that kind of tighten the tissue on the inside of the vagina as well. So some of this is cosmetic and some of it could be functional, like the lasers could be used to help improve sexual function or decrease leakage. The thing I'll tell you about the lasers is they can be effective, but they are very costly, like thousands of dollars. And you have to continue to do them in order. Yeah, you have to continue to do them in order to see results. So it can be helpful, like if you do a treatment once a week for 12 weeks, but after you stop, you have to continue.
So this is not covered by insurance. This is elective, and
typically it's out of pocket. And that may change but it's still it will still be costly. But again, even when you do these lasers, like you still have to do the strengthening, because once you stop the laser, the benefits go away. And you need to have that underlying pelvic floor strength there. So whether you're using topical estrogen, whether you're using lasers, the strength training, pelvic floor training component is a must, because that is the only way your muscles maintain strength. There's no easy way. unfortunately.
I mean, it's like putting makeup on a mess without fixing your skincare. You've got to strengthen. I'm thinking about that bottle, that tube of cream, estrogen cream in my drawer. I always, because I'm a breast cancer survivor, I'm always nervous, but I've been cleared and approved to use the estradiol or whatever it's called. It's,
estradiol.
It doesn't work if it's in the drawer. Yeah.
Right. And so the way that that's typically used is once a day for 2 weeks when you start, and then you twice a week ongoing, 2 to 3 times a week ongoing. It has to be prescribed by a nurse practitioner, PA, or a doctor. So physical therapists do not prescribe medication in the state of Louisiana or nationwide. But there has been approval for folks who have estrogen-driven cancers to use it because the amount that's absorbed into the bloodstream is undetectable, which means if we take your estrogen blood levels before and after using these creams, there's no change in the blood levels of your estrogen. But it's also, you can use it, Melanie, if your doctor's giving you that thumbs up. And it's 2 times a week for the rest of your life. Like you don't, again, once you stop it, you lose the benefit. So 2 times a week forever. It's going to help prevent urinary tract infections, urgency, leakage, improve lubrication, increase orgasms, all of those things. But I will also tell you this. It is not the same as using an estrogen patch or ring or gel. That's systemic estrogen, and that is different than vaginal topical estrogen. So if you're like, oh, I already am using estrogen, that's a different thing than using a topical estrogen cream. And for you may not use systemic estrogen like a patch, but you can use the cream. So I just want people to know that there's a difference, and there are different reasons for using them, and they're not one and the same.
I think that's really important because estrogen is a big term. And then there's bioidentical hormones and other things. You really got to, it's always an individual treatment plan. It's not what your friend is doing or your best friend or whoever.
Correct. Or what you saw on social media or read in a Substack. It is very nuanced and individual.
Yeah. I mean, I've learned that, and I'm trying to unscroll and it's like, how you do search, because like just searching pelvic floor health, do you know how much is coming into my feed now?
I am sorry, but I'm also not sorry. So
I'm glad I didn't do poop
to my feed.
If I did poop, it would have been a whole other thing. But sometimes, and then, this is a funny. So I was doing it because I'll talk about anything. At one point, I ended up on Pornhub's mailing list because I did a show on. It was crazy, like the stuff, so, but I think, so we have about a few minutes left. What are some common questions that maybe I haven't asked that you get asked frequently that you want to share in the last 3 minutes?
We've covered a great amount, but I would say one is it ever too late? Like, is it ever too late to go to pelvic floor therapy? It's never too late. I have worked with women in their 80s, 90s, who have pelvic floor issues that are still seeing benefits and results. It's like saying, is it ever too late to address my back pain? Is it ever too late to start strength training? No, never. The second thing is, do I have to do these exercises forever? And the answer is yes. Like, these are muscles. When you don't use your muscles, you lose their strength. So it's not a very rigorous routine. Like in my app, the workouts are 10 to 15 minutes 3 times a week. So it's not, life altering, but it does take some commitment and consistency for you to continue to use these results. And then how long does pelvic floor training take? If you are doing this at home and just using exercises and things like that, I would say between 4 to 6 weeks, you'll start seeing improvement. If you're going to a pelvic floor therapist, it's about the same. 4 to 6 weeks, you'll start seeing improvement to let you know that you're on the right path. But then we also work with physicians and nurse practitioners for medications or, dietitians or acupuncturists or psychotherapists. So we're just one piece of the puzzle in navigating pelvic health. We're an important one, but I often have folks who I work on a team with to really optimize the results for patients and for the women that I work with.
I think that's so great. Let's Juan, my engineer, let's put the copy of the book up again, because I think it's a terrific book. I learned a lot. It's called Floored. I love the name. A Woman's Guide to Pelvic Health for Every Age and Stage, because this is something that, should be part of your healthcare plan, as I like to say, from the moment you become a woman to, because, there's so many things. The moment you become active sexually, the moment you become a woman. So before you, get into pregnancy and then post-pregnancy and perimenopause and menopause and, I'm leaking. I just got to tell you, when I packed up my poor mom's home, there were, I swear to God, almost 100 mini pads. What are those
Oh,
leaky
yeah.
pads?
Like liners and continence
Boxes.
liners.
I was trying to
Yeah.
use them. I was using them to clean stuff. I didn't know what to do with them. A
Well,
face
and
mask.
think
There was,
about the cost of that. I mean, think about the
I
cost that
know.
she incurred. I mean, it's astronomical, And again,
Yeah.
this is where I feel like we're taxed for being women. And I think one of the things is that like this training can start from a very young age, whether you have
Yeah.
daughters or granddaughters who are starting to menstruate, starting to become sexually active, going through pregnancy, postpartum. Like at every stage of our life of being a woman, our pelvic floor needs certain types of care. And that's really what this book does, is it walks you through every stage. So you may think like, oh, I'm past menopause, there's like nothing I do. I'm like, no, if you're peeing and pooping and exercising, like you got to know how to take care of this muscle and this part of your body. So but it's for even the next generation of women after us, so they don't live in the dark about their bodies and can really be proactive about this care.
I think that's a great way to surmise this. And, and my last point is, let everybody out there, if you're so focused on your face and taking care of your face and making sure it ages well, just remember the neck, go down a little further south, because you got to take care of that body part really well too. It's got to be functioning, because you don't want to end up being an incontinent little old lady, trust me, or have a bad back or whatever. So you got to take its equal parts, you got to really focus. Yeah,
absolutely.
God,
And thank you.
Oh, it's a great conversation. I knew it would be. I was telling my engineer beforehand, this is going to be a great show, because it really matters to so many women, and the conversation needs to be open and honest. And Dr. Sara Reardon, you were doing that. I was so impressed when you were talking at the New Orleans Book Festival. Give them a shout out. And you've got a great TEDx talk on your site. Again, it's thevagwhisperer.com. Lots of resources on there. You can join. You can try the trial for a little bit, and there's a free booklet I downloaded. So thank you for joining me. I'm sure our paths will cross again, because we're both here in New Orleans, Louisiana.
Thanks for having me, Melanie.
Absolutely. So I hope this show's been helpful for everybody out there. I like to bring up conversations about every way to take care of yourself. So as always, you have a choice in life on how you want to live. Always choose fearless and fabulous. Put your self-care first, and always try to live life on your terms. Thank you.